My name is Dr. Chris Keeys. I'm a clinical pharmacist licensed in the state of Maryland and in DC and Virginia. I practice in Laurel, Maryland and in the District of Columbia. And this past week I've been on the front lines of work underway within Johns Hopkins Medicine at Sibley Memorial Hospital, and as a member of the Maryland pharmacy practice community, I'm engaged in the carrying out of public health and healthcare initiatives that are enunciated and authorized by our governor. Where are we at within Prince George's County and Charles County with respect to COVID-19? Recognizing this as a new virus in humans, both the county executive of Prince George's County as well as Charles County has declared it a state of emergency following that of our state governor. We are specifically in both counties, we have identified COVID-19 positive residents, and we are at this point following the federal through the CDC and the World Health Organization guidelines that pertain to how our public health response should be, including the distancing, we call that social distancing, 6 feet apart of all of us within the county, both healthcare workers and our residents. We are to be washing our hands and avoiding the placement of our hands in our eyes, mouth, or nose, as these are routes by which the COVID-19 virus can infect an individual. And we are involved in those activities that really reduce the population that can be infected amongst each other, including here at Grace Brethren Church, where appropriately we have discontinued our gathering as a congregation, as well as at the school, so that we can take part in the national response to what is currently a public health threat. As stated by Dr. Carter, our Prince George's County Director of Health, we are really responsible as individuals to not be conducting ourselves in a manner which would facilitate the spread of this new virus. And to that effect, that means that we should be remaining connected to the information that's emerging from our public health officials and our healthcare providers, such as your doctors, about how to reduce the spread of this and protect your own self and your families, as well as we should be taking good care of ourselves as we understand there are high-risk categories for contracting the COVID-19 virus. But in addition to the high-risk factors, some which we can't avoid, such as if we already have hypertension, diabetes, or kidney disease, but we surely can be involved in the spread, reducing the spread, which really means understanding that this virus is primarily transmitted through secretions or droplets that will result from coughing and sneezing, and in taking it through our eyes, nose, and mouth from an infected individual. So with that being said, it's really critical for us to avoid crowds, for us to follow the mandates and the recommendations from the public health officials and from our governor and our county executive, as well as we need to do the things that keep us out of the hospital to the extent that we can, manage our chronic conditions well, getting information about how to improve our health, as well as for many of us, we do take those things like supplements, zinc and vitamin C, elderberry, as examples that may promote immune response to help protect us. There's no guarantee that any of these things are going to totally protect us, but reducing the spread is extremely important because as a healthcare system, our hospitals, including the University of Maryland at Prince George's and right here in Southern Maryland, these are all places where there are known shortages occurring, protective equipment like masks, medications like inhalers for asthma and COPD, and so we should not try to do anything that's going to increase the burden while we're preparing for what presumably is going to be more infections. What do we as a congregation have the opportunity to do during this time of COVID-19 as a faith community? I'm excited in that we are in our 21-day reading of prayer and fasting, and I would just recount for you what is in the initial chapter of our text, Matthew 18, 19, and 20. that we are granted an opportunity here by praying in agreement for that which we need, and we need healing and resolution of this problem, to take those prayers in agreement as a church body before our Heavenly Father, the throne of grace, and to have the faith that we have been granted to really facilitate for us what will be the recovery that we all seek. And we need to pray for each other, because we have many in our congregation who are at risk, as well as we have many in our congregation who are on the front lines as healthcare providers, and so we covet the prayers of each other. We all look for the resolution of this medical and public health emergency, and so I just want to bring you a quick update in that we are actively developing a vaccine. There actually is vaccines for coronavirus, example, veterinarian vaccines for another strain. We also are looking at both medications that we currently have available in pharmacies and in hospitals that may be beneficial in preventing and treating the COVID-19, as well as developing new medications. So I do want to leave you with the realization that we have learned and resolved many virus-related infectious diseases in the United States and across the globe, and so we anticipate being able to do so with COVID-19. We just have to get through this period of vulnerability and lack of active treatments.